All right, so if everyone will take a seat, we'll go ahead and get started. Marking. Thank you. So good afternoon. I'm Cindy Stotler with the Arizona Department of Housing, and I'd like to welcome you to session 3 of the Combating Homelessness track. This session is titled Hotels to Housing. Many of us had to rapidly adapt our service models during the pandemic to accommodate safety protocols and continue to serve our clients. One of these adaptations was the use of vacant hotels to provide housing and wraparound services for homeless persons to distance for safety, stabilize them in comfortable housing, and successfully move them on to permanent housing. In this session, we'll hear from Lisa Glow, Chief Executive Officer of Central Arizona Shelter Services, and Elizabeth DaCosta, Senior Director of Housing and Community Integration at Community Bridges, Inc. They will talk about their hotels to housing projects and how their success may be used as models for future regional specialized transitional housing. I'm going to remind you this session is both live and virtual. So before we begin, I'll ask everyone to continue to allow each speaker to complete their presentation, and then we'll open up for questions between the speakers. For those of you who are live, there's a microphone in the center of the room here. If you'll come up and ask your questions at the microphone. And for our virtual watchers, please submit your questions in the chat box and we'll ask them for you. So with that, we'll go ahead and get started with Project Havens. Please welcome Lisa Glow.
Thank you, everyone, and thank you for being here late in the afternoon. And hopefully this will be very entertaining. And we do want to make sure people think of their questions. There'll be plenty of time for that. And also share with us things that you think would be important for all of us to know as well. So I've been CASA's CEO now for 4 years, and my background is in law, government, public policy, fundraising, public-private partnerships, and I've been in the 501c3 sector about 17 years. There is no harder work than working in this system, is what I believe. So because it really is complex, solving homelessness and all of the underlying issues. So the lessons from COVID-19 and hotel solutions is what I'm going to talk about. Very briefly, Central Arizona Shelter Services is going on 37 years. We're based in Maricopa County. 1983, we were founded by Mayor of Phoenix, Terry Goddard, pictured here, firefighters and other leaders to respond to a homeless crisis back then. Lack of affordable housing was adding to this, just as it is today. We opened up in 84, had a family and adult shelter combined. Today, we're a 470 bed adult shelter, expanding to 600 soon, also becoming trauma-informed certified, 120 bed family, shelter apartments, COVID-19 hotel accommodation, which is what I'm going to talk about. And we just recently, about 7-8 months ago, opened up a navigation center in Glendale, not a shelter, but a navigation center, but that's for another day. So our mission is to prevent and end homelessness among individuals and families while advancing compassionate community solutions. We amended our mission a couple of years ago to add prevention to our mission because we believe that's a place we have to go as a community. Also, advancing compassionate community solutions reflects our commitment to advocacy, working in partnership with neighborhoods, and advancing innovative new solutions that will work. We serve about 5,600 people annually with shelter, case management, and housing. During the pandemic, we remained open 24/7. In fact, for 37 years, we've never closed. And during the pandemic, one thing I wanted to point out, because I know a lot of providers scaled up their housing programs with short-term assistance, flexible assistance. We helped 850 people to quickly get out of homelessness or with eviction prevention, and then 275 through rapid rehousing. That'll tie in a little bit later. When the pandemic struck, 30% of our 470 daily shelter clients were elderly at our downtown shelter. The majority of those had disabling and medical conditions, and we'd had no ability to social distance with closely placed bunk beds, shared bathrooms, shared dining facilities, and so on. What we needed was obvious: safe places for the most vulnerable to isolate, to create social distancing, get the PPE we needed, et cetera. We needed also to shore up our housing programs to move people quickly. And we needed to pivot and make eviction prevention part of our expanded housing services, and of course, to adapt as quickly as possible. So what we did was, with the support of the city of Phoenix, in June of 2020, we opened up what we called Project Haven Hotel, specifically for seniors and medically vulnerable persons. I want to note that this was not a new idea for us to shelter the seniors separately. It was something we'd been working on for a few years. So the mayor, Kate Gallego, and the city council knew this was something we were working towards. We had been running a bill for 2 years. We had a bill, in fact, Senate Bill 1283, that was moving forward with an appropriation to open a senior shelter right before the pandemic. Pandemic struck, all budget bills stopped. So we were on the pathway to making a different model for our seniors to isolate. So city council's aware, legislators aware, this is a priority for us. So we seized the opportunity, and with CARES Act funding, we're able to open this hotel. It was specifically seniors over 60 and the most medically vulnerable. We had a couple of folks who were on hospice care stay there. We had people with HIV/AIDS. Everyone had to be COVID negative, test negative when they went there. We had 100 rooms, 87 of them for clients, the rest for case management and food and other services, because we didn't have congregate spaces for folks. This will close at the end of September 2021. And I want to note one thing here that was kind of remarkable. The hotel kept rooms open to the public, and the partnership with the hotel management was pretty extraordinary. If you were talking to Anna, who was the hotel manager, she would keep this going forever if she could. She fell in love with the clients. She was side by side with our case management team. So it was a true partnership with a private sector partner. So importantly, it was a closed campus model. Everything was on site. We entered into a lot of MOUs with different partners. Importantly, and I think some of our friends from Phoenix are here, Tamara Spendley, raise your hand if you're here. She was very instrumental in working with us on setting up the model at the front end. 1 to 15 case management ratios. That's not what we have at our downtown large shelter that is going to be expanding to 600. Expanded housing resources, including vouchers from the city of Phoenix. I cannot emphasize enough how important having those flexible vouchers was in getting people into housing. 24/7 on-site security at all times. We had additional housing partners come to the table, United Healthcare. Well, CBI has already been there. You'll hear from Liz. Resilient Health and some others. Medical and mental health partners, Circle the City, came every week to do medical appointments, COVID testing, vaccinations, food service, 3 meals and snacks every day. One of the partners I want to point out, the AAA, is the Area Agency on Aging. So when you look for doing something for seniors, the Meals on Wheels program is a resource. So we were able to get a lot of the meals donated through that program for the 60 and older. Laundry service, we had a nonprofit social spin, job support, housekeeping, and daily room checks. The daily room checks were really important to make sure there were no meth labs or anything going on. I heard that happened in some of the California hotels. And we had government benefits enrollment eventually on site from the Arizona Department of Economic Security. And then other things, some recreation, some spiritual guidance, clothing, move-in kits. There were also workshops held by one of our behavioral health partners, Resilient Health. CBI is also a behavioral health partner. And in those workshops, we had pretty good attendance where people were getting enrolled in access. Our outcomes, 230 clients were served. We're still in there. We're wrapping up. We'll maybe have another 10 to add to that total. We projected 100 was the goal, although we knew it would probably be higher. About 27,000 bed nights. Most came from our downtown shelter, but they did come from other places as soon as word was out that there was this safe place for the most vulnerable who would have a bad outcome if they were to catch COVID. 87% were over age 55, which is how we've been defining seniors as 55, 47% over 61, and many in their 70s and 80s. I spent a few hours at Project Haven a couple of weeks ago. I did the room checks with our staff. I talked to an 84-year-old woman who'd been in low-income housing all her life. She lost her housing. Really difficult to get back in when you lose your housing and you're 84 without any prospects of employment. You go on a waiting list. I spoke to a 75-year-old woman who'd never been homeless, evicted, first time homeless. So Both men and women, similar kinds of stories. But one thing that was really consistent is we did not have problems with the neighborhood. We did not have violence. No drugs and alcohol were allowed. There was a little bit of alcohol we found, and I think one person smoking marijuana. But when you're dealing with the elderly population, you're just not going to find a lot. I don't believe a lot of meth users or things as concerning, which made it easier to get neighborhood acceptance. Common client traits, as I mentioned, first-time homeless, lost a job. For most of them, they did not have a family safety net, is what they have told us. So 70%, as I mentioned, had a positive housing exit compared to 39% of the same population being case managed at our adult shelter. 118-day average length of stay, that's longer than at our adult shelter. Seniors often stay longer when they come into shelter. 400 plus medical appointments by Circle the City, 54,000 meals provided, and there were other outcomes. We're still putting together a final report. So what's next? This is the exciting part. We are in the process of buying a 144-bed hotel. What I want to talk about briefly is the key steps to succeed. As I mentioned, we've been working on this for a few years. We never imagined until the pandemic that the hotel could be the solution for our senior facility. We're not calling it a shelter. We're calling it a facility for displaced seniors. Shelter continues to get a bad name, so we want to be careful about that. And the right location was critical. We had been looking at the West Valley of Maricopa County, where we've seen the highest rise in unsheltered. That's why we made the West Valley a priority in our legislation and in our advocacy. And we chose a hotel in a neighborhood that is in need of upgrades and safety to better the neighborhood. That's tied in directly with getting neighborhood support, which at this point, knock on wood, we seemingly have. Second thing in the key to success is enrolling politicians all along the way, something we've been doing for a couple of years, gaining the trust of the neighborhoods in advance and every step of the way. We've taken countless neighbors, politicians, and others on a tour of our Project Haven 1 hotel so they can see the model. And people walk away and they feel, I could live with this in my area. Smaller, closed campus, specialized services, everything on site. So you have to consider the model in any kind of design that you're doing with a new shelter. I think most of you, if you are in the homeless services, you know it's not easy to go to a community and say, I want to open a shelter, because you face opposition and fear. So you have to spend a lot of time, I believe, with getting that neighborhood input, including on the design, including before you file your zoning or use permit. It's also important, of course, to identify the sustainable revenues. So there is a lot of available government funding now, and we have a pretty detailed revenue plan for this. I wanted to put up here Senate Bill 1848. We eventually did get a bill signed by the governor a couple months ago for the senior facility. So 1283 was pulled, the budget appropriation pulled, but now we have a bill making this a priority. It was important to see that through for us. And we had 53 sponsors at the legislature, bipartisan. So it was led by a Republican and had strong bipartisan support. The last point on here is, we have been relentless in not giving up. While we have tried for a couple of years, we've always kept this as something we were going to persist to do. Actually, let me add one other thing that's important. Since we're in the process of acquiring the hotel, I was on a call this morning with the city of Phoenix about the site plan. You've got to have a site plan, and you need to communicate that with your city and get their input and make sure the neighbors give you input. This is how you avoid getting a, what is the word? Debate. Well, you're always going to have debate, but we're doing everything we can to make the use permit process smooth, and our use permit hearing is in September. Project Haven 2 is a new model for vulnerable senior citizens. These are just the elements of what we'll be prioritizing there. Age 55 and older. Clients have to agree to case management and work on a housing plan. It'll be a closed campus, no walk-up admission. We'll have one entryway with security. No visitors allowed unless someone's picking someone up. These are all very similar to what we did at our Project Haven temporary location. So similar on-site services, as I went over, with MOUs with other partners. Curfews and check-ins required, fully fenced, monitored with 24/7 security, regular neighborhood meetings. So these will probably be in the stipulations, a lot of this for our use permit. And we've already discussed all of this pretty much with neighbors who, at this point, like I said, we think we've got the support we need, but it's real important to lay that foundation. I'm on my last two slides. So lessons from the pandemic and also from our Project Haven 1. And actually from 37 years of service, nothing surprising here. On the journey to ending one's homelessness, housing resources are everything. In the case of Project Haven, we had vouchers. We also have rapid rehousing, but the flexible financial assistance that I mentioned earlier is absolutely critical. If you have someone who hasn't been homeless long enough, they need $500,000. It's a pathway to getting out of homelessness quickly. So being able to leverage all of that, having enough resources so you can move people out was everything. Secondly, the case management services are essential, both the quantity and quality. We now have a specially trained team that works with our senior citizens. Something we realized is we needed to become more specialized in working with seniors, understanding how to get them into Altex, understanding if there might be dementia and getting a referral for an evaluation, all kinds of things. And we're continuing to get deeper in that arena with I think it's 6 people on our team currently. And we have a special screening tool. So someone comes in the system through coordinated entry, seniors get a second screen when they come into the shelter. And then we can put them on a waiting list for case management, make them a priority, but more individual attention for the most elderly who we believe will fall through the cracks. Doesn't mean we're not doing all the other things we do in a shelter to serve folks, but we've made that one of our priorities. Some of the intangibles that have been critical in the design, peer support is a critical stabilizing factors. Having seniors supporting seniors has made a difference. And I spent 2 nights staying at Project Haven when my air conditioner went out last summer. So I was in one of those 20 rooms, walked around, saw what was going on. Clients were in the smoking area, chatting, having philosophical discussions. And I saw people I'd seen at the downtown shelter and they looked better. They had the dignity of their own room, they had space and safety. A lot of people don't feel safe in a large shelter model or in a community where there might be tents and they're walking through. Another important sort of intangible lesson is community-oriented environments bring support and healing to the process. At Project Haven, people know each other, look out for each other. So there is something to the smaller specialized model of shelter. And then the value of a safe and dignified space to get back on one's feet is, for us, immeasurable. We think trauma-informed care principles need to be part of the design in our homeless shelter system. Final thoughts. COVID exposed weaknesses in our system that we must begin to address for the homeless and those at risk of homelessness as well. So we've always had public health challenges in large shelters where we'll have an outbreak of the flu or TB or other things. Public health has been at the table in a significant way. I don't know if Rachel Milne is here from the county and Scott. Remarkable people came forward during the pandemic to help support the public health needs, but I think we need that on an ongoing basis. We also have a very high eviction rate in Maricopa County, second highest in the nation before the pandemic, and we have to be more proactive. That was another weakness exposed where we need to do something to address it, legislative and otherwise. The third bullet on here, new specialized shelter models are needed. The city of Phoenix has a homeless plan and a housing plan. Maricopa Association of Governments has a regional plan where they are recommending specialized regional shelters that are smaller. Project Haven 2 will be one of those, but there are other populations who could benefit from being with their peers and getting more focused services. Hotels can be used today in this emergency and transitional housing, and we're thinking down the line, and I know other communities are, convert them into permanent housing later. So that's the impetus is get in now, think about that later after your 5 years of use on your federal dollars. And my last point And those of you who know me have known I've been talking about the silver tsunami for a while. I think it needs our continued attention because by 2030, researchers project that the 65 and plus population will triple. That's the homeless population. That's Dennis Culhane's research. And I think, getting philosophical, I think in a great society, we take care of our elderly, and I think we need to make housing a priority. I also personally believe that if you focus on a population where a lot of people have maybe more empathy and understanding, you're going to help the overall population of the homeless. You can start to make traction with different kinds of models. So that's it.
Thank you, Lisa. Wow, that was a lot of information very quickly. Lisa is very passionate about what she does and speaks very quickly. So that was good job. Just an observation from me. This is our third session on homelessness, and I'm finding it very interesting that language is being emphasized. If you were here earlier, you heard Irma Hollenby from the city of Scottsdale talk about how affordable housing, the words affordable housing triggered certain kinds of reactions. So she changed the language around and called it housing affordability. And that got a better positive reaction. And then I just heard you talk about shelter you get a really negative reaction when you say shelter, but you said Center for Displaced Seniors. So I think that's just very interesting. It seems to be a trend that maybe we're all learning to communicate better and in different ways to make our projects more successful. So thank you for that. I'll open it up for questions now. Do we have any questions for Lisa about Project Haven? Not
knowing anything about some of the stuff that you're talking about, what do you mean by trauma-informed certified?
Yes. So there is an Arizona Trauma Informed Institute that does a 15-month training. We just started. So it's going to be hard for me to explain it, but in the context of making environments safer and more dignified for people who've been through trauma. There's the physical environment. And if you visited our adult shelter, you wouldn't feel that it was trauma informed, which is why we're renovating as we expand. So people do better in those physical environments, but then what's the environment to match that with the how you engage and interact with clients and with one another. So we just started our training, but there is information on the website as far as physical design, colors and light and all kinds of things play into that. So with the redesign of the adult shelter, that will be factored in. We have an architectural company who understands the trauma-informed environment principles.
So it's not just your bedside manner, so to speak, it's the actual physical environment.
Yep.
Thank you.
Yeah.
No other questions? You have a question from the virtual.
Yes. So Kat says, thank you very much for sharing this excellent endeavor. I found your presentation very engaging. Kat's question is, are you using the coordinated entry system to prioritize participants for referrals into Project Haven? If not, how are you identifying the eligible participants?
Yes, we have been using coordinated entry to identify eligible participants. And worked with coordinated entry when there was someone who we wanted to get in who hadn't gone through first. So everybody who comes through CAS will go through coordinated entry, but I know there've been a few instances where some of the folks who came into Project Haven didn't go initially. I believe that's how it worked, but everyone goes through coordinated entry eventually. You know, someone who might be sleeping in their car, like the 75-year-old lady that I mentioned. Do we give that person the option to go there right away that day and then get their VI SPDAT done? You know, so yeah.
Good question.
Mm-hmm.
Any other questions for Lisa? Yes.
Was the scale sufficient enough to significantly
Yeah, we did look at that, and we had still a lot of seniors in our shelter, and we still do. We reduced the number of beds from 470, we were at 350 or so, and we're now scaling back up. But I know we ran the data not long ago, and it was still a third that were over 55. So we had to prioritize the most elderly and medically vulnerable for safety reasons and still keep social distancing. I know when you hear from Liz, they also made priority for taking elderly, and there were some other places set up on where our adult shelter is at the Human Services campus for elderly as well. One of the things that made our model a little different was all self-contained, everything on site in a closed model. We actually asked the clients, I forgot about this, to really self-isolate in those beginning weeks because they all tested negative and we didn't know what we were going to find, you know, and needed to try to keep people safe. But it wasn't, we could have used 3 more hotels given the rise in the senior numbers personally. Absolutely. And I think, you know, if people are thinking about doing hotels in their communities, I think focusing on the population of the vulnerable seniors, to me, I would advocate for that because you get them out of large congregate shelters. You give them a safer space. They stay longer in shelter. We had all that data before we started Project Haven. Over the last few years, they're our longest stayers. They aren't going to qualify necessarily for rapid rehousing because they haven't been homeless long enough. So I think there's a huge opportunity for communities to do hotels for seniors, other populations too, but neighbors are more apt, I believe, to be accepting of the senior population when we're trying to scale quickly.
Another question from our virtual track?
So we have 2 questions, so I'll give you the first one and then the second. So Deirdre asks, could you tell us more about the process of gaining neighbors' trusts for the facility for the facility for the displaced seniors? What approaches did you use or hurdles did you face, and how did you overcome them?
Yes. So there's a person on our staff, his name is Craig Tripkin, who's worked for CAS 8 or 9 years, who for the last 8 years has been an advocate with the neighborhood. So these are people he's known for a long time. So I think it's really important that you as an agency, you build those relationships. Long-term makes sense. You gain trust. So when we knew the West Valley was where we wanted to focus, Craig was immediately in touch, talking to people. We were looking around. He knew who the advocates were. So you have to know who the neighborhood leaders are, and you need to go listen to them. For Project Haven 2, that's what we've been doing, listening and interfacing, but Craig already had the relationships with folks. And then you have to be willing to make concessions. So we'll have stipulations in our use permit where we meet monthly with the neighbors, where, you know, the things I talked about, 24/7 security, the perimeter lighting. In addition to the neighbors, a lot of the neighbors have relationships with the neighborhood services people from whatever city. So you need to be connecting with those folks as well, because those neighborhood services people know exactly what kind of things are going on, and they want to help you. So we're getting a lot of help from Phoenix as well. So neighbors, city, and you want to have a good attorney working with you when you get to your use permit phase 2.
The next question is from Jess. She asks, can you say more about what a closed campus means and how that works operationally?
Right. So Project Haven 1, we served just the people on the campus. There are no walk-up services. We're not providing meals for folks who might want a meal. So we don't have any services other than for those who are there. Similar to some of the rescue mission models where they're gated, they're closed, and you don't have walk-up service. Also not allowing visitors because we don't want to have partying and different things going on. This is meant to be a temporary stay with support. So people who go, they agree to those rules, so to speak. Did that answer it?
Mm-hmm. Any other questions? No. With that, we'll move on to Liz DaCosta from Community Bridges.
Thank you so much. Yes, I'm Liz DaCosta, Senior Director of Housing and Community Integration Programs with a nonprofit organization called Community Bridges. I have been with Community Bridges for 12 years now. Very excited to be here at a conference with all of you, sharing information about things that we learned during the pandemic and kind of where we're going. I think that that is how we get to a place of evolution in the way that we perform services and evolve to try to help make things better. So first of all, we'll start off with the origin of the hotels and Community Bridges involvement. As a direct service provider, I think it's really important to first look back at how we used to use hotels pre-pandemic, and we didn't use them. It was extremely rare. Maybe a family that we find living in their car, and our fire department or police department scrounges together some money to be able to pay for them to stay in a hotel for a week. The service provider is somewhat administratively burdened in trying to quickly help that family access a shelter. The family's burdened because we're having to try to move them so quickly into a shelter. So it wasn't something that we used, and it wasn't used very well. When the pandemic hit, of course, we all recognized it as a public health crisis, and it got the resources and attention that it needed in order for us to try to change the system and do something a little bit different. So originally, we started off with trying to do just that, address the COVID-19 pandemic, help move individuals who were considered high risk into isolation hotels so that they too could stay home in the same way that we were. Also, hospitals were discharging individuals who were experiencing homelessness, who were positive for COVID-19. At times, we would find them in the parks with discharge paperwork that said that they needed to quarantine for 14 days. So through that, we worked with our community leaders to help try to come up with a solution, and that also led us to the hotels. Originally, we were focusing on those experiencing homelessness. We expanded to persons under investigation and individuals who are COVID-19 positive. Our outcomes were to help them isolate, help them get connected to medical services so that we could address the pandemic. As far as CBI's expected role and responsibility, we're an integrated healthcare agency that's been serving our communities for over 30 years when it comes to addressing crisis. So we serve as an active community partner with that all hands on deck culture. It was common for us to see these types of things happen where we're dealing with significant substance use disorder when it came to the opioid crisis, right? People who were living on the streets experiencing homelessness who had chronic medical conditions, and it urgently needed to be addressed. So we were able to use that existing infrastructure to add a ton of PPE, get connected to our medical providers for some additional safety protocols and how our teams addressed it, and then stay out there in the field and continue doing what we knew to do best. We use a peer culture, and I'm somebody who has lived experience. And so I find that I feel in my work, I am compelled to give back to the community that I honestly took so much from for so long through my addiction. You know, my family, my neighbors, and people like that. So I feel a sense of responsibility when things like this happen to get out there into the community and start being responsive in the cleanup and how we all come together and start to get this addressed. We have an entire peer workforce of over 500 peer support specialists who felt the same way. What we needed most in the pandemic was a workforce, people to outreach individuals experiencing homelessness, take their temperatures, talk to them about COVID-19, where they can access hand washing, tell them what the symptoms are, help them get connected to the hospitals. We needed people to staff the shelters and the hotels, be there 24/7, go through outreach, help them come in, knock on their hotel door, provide them with meals. So CBI used that existing workforce to come in and meet that need. I think that as homeless providers, we've been hustling for a long time. So when the resources came in, because it was this public health crisis, we were thinking, okay, we'll address the pandemic, but at the same time, we're still constantly striving towards ending homelessness. So we were able to then use that same model to strategically address the existing gaps within our community. How do we help bring people indoors for isolation? How do we increase our shelter beds that we were already lacking? How do we help our police by helping them have access to these shelter beds? And then how do we use these resources to end homelessness? one of the most important things I think, and it kind of ties back to us being at this conference, right, is we were able to do so much in Maricopa County, and I think Pima County too, because we were all constantly having conversations with each other. A regular daily meeting with CAS, with the Human Service Campus, with the county involved, everyone at the same table just sharing ideas. And I think in our evolution, we need to 100% continue that momentum forward. We were able to put up 6 shelter hotels during the pandemic in partnership with our various counties, municipalities, and community leaders. So we included some of the outcomes from some that I think are most important to talk about today. The first is the Mesa High Risk Hotel. I talked to you about the fact that the police used to try to scrounge together funding to be able to purchase those hotel rooms. Well, in Mesa, the city came together and they used some of the funding that they had to buy 75 hotel rooms. And then they funded CBI to provide the 24/7 support services at the hotel. This provided a relief valve for our police department. They were trying as best as they could when they came across somebody who was experiencing homelessness during the pandemic to try to help get them connected to an available resource, but they didn't have a lot of resources in their toolbox. So when they purchased those 75 rooms, that model is where a Mesa police officer can come across somebody experiencing homelessness, contact a Community Bridges outreach worker who they also funded to be up 24/7. That outreach worker would go meet with that officer and assist with moving that individual over and into the hotel. And then we've got on-site support service staff at a 1 to 25 caseload ratio at that hotel. So then that outreach worker and that officer get back to what our community needs. And then those support service staff at the hotel come in and take over. We served 484 people through those 75 rooms from July 2020 through July of 2021. 144 of them were experiencing chronic homelessness. The length of stay, the average length of stay was 69 days, and we had a 33% exit to permanent housing. The exit to permanent housing is our rapid rehousing vouchers, our permanent supportive housing vouchers. So those numbers do not include when somebody was brought in off the streets by police and then maybe transitioned over into a substance use treatment facility or a psychiatric facility, or transitioned to another shelter if that was what the treatment intervention called for. So through that, we were able to relieve our officers of 1/3 of the street homelessness that they were dealing with. The next is the Sure Stay model. And that we targeted those beds towards whatever the community needed. I think that's the most important thing, is that it wasn't necessarily through coordinated entry. We would be on those calls and we would say, okay, we have these 35 rooms. Who's most in need of it right now? So initially, our medical provider, Circle the City, had completed risk assessments for people experiencing homelessness. So if you were high risk for COVID-19 related symptoms, then we knew who you were, and then you would be prioritized over into those beds. Outside of that, our street outreach teams were still continuing to perform outreach services in our community. They may come across somebody who is vulnerable, who is, they've been working with for a period of time, who has been unwilling to move into one of our congregate settings, who they now get to offer a hotel room to. Life-changing. So there are people out there that are living on our streets who have become accustomed to living on the streets. They have had to shut down all basic needs a lot of the basic needs that we have about comfort, curling up into a bed with a pillow essentially, right? Because they find that they've had to sleep on those bus benches. So when we come and we interact with that type of an individual who's become accustomed to living on the street, we've got to offer them something a little bit more than what it is they've already been surviving with. So through those hotels, we were able to get so many of the people who we couldn't get to come in before into the hotel. And then there you go. Now you've got a 1 to 25 caseload ratio, a case manager working with them every single day to address substance use issues, confidence issues, lack of social connection issues, and then move them into permanent housing. We served 188 people through that project for that time frame. Their average length of stay was 64 days, and then their exit to permanent housing was 66%. I think this is interesting because I think that our police might be dealing with a different population when they're responding than what our outreach teams are. And so maybe there's a little bit more potential for engagement with those that were working with outreach that led to the results we got on that exit to permanent housing. The other one I wanted to make mention of is actually the CBI Bridge Congregate Shelter. That was a resource we already had in our community. It was already a building where we had beds where we can move individuals who are experiencing homelessness into. That model was very specifically designed around a gap that we were experiencing where you could be referred to a rapid rehousing voucher, but you're still living on the streets. And so the team that's trying to move you and help you find an apartment, get your ID, all that other stuff that goes with it, they've got to go find you behind the Circle K or wherever it is that you're at that day, right? So the bridge shelter was designed so that once you get referred to a permanent housing solution, we can move you indoors. Now that navigator case manager is just meeting with you every morning, wherever you're at, to continue on with that housing plan. So it was dynamic. The results we got were, we served 168 individuals that first year. 145 of them had been experiencing chronic homelessness. 112 of them had 3 or more disabling conditions. Their average length of stay was only 38 days, and 74% of them were exited to a permanent housing destination. The key thing there was they had a voucher in hand. I mentioned this shelter though, because when the pandemic hit and we significantly lacked shelter beds in our community, we were able to take our existing homelessness resource and use it for whatever it was that the community needed. Circle the City originally was working to have those who were COVID positive in their respite shelter. And we needed to free up those respite beds so that people who were COVID positive could move in. So CBI changed our intake protocol. We started to transition the individuals who were in their respite center over to our shelter. And then now the respite center was available for individuals who were COVID positive. So just decreasing exposure. I talk about that because it's extremely important for us as homeless providers and individuals who work in this system to have these buildings, to have these assets, to have these resources already available so that when things like this hit, we have the resources to be able to respond. It's a blurry picture, but I think if a picture says 1,000 words, then this one says 1,000,000, because this is a photo of a couple that our street outreach team found during the pandemic. Originally, they wanted nothing to do with community bridges, like you often hear anti-CBI. And what that photo says in that first cardboard box is working with CBI, please be patient. And then the one next to it says rapid rehousing program. We'll use this everywhere. So basically this couple, they had gotten to a family dispute with their son during the pandemic, all closed into the house. I mean, who might have experience with that? And so it led to them having to go live on the streets. And they had been homeless for greater than 90 days, but less than 1 year. In that time frame, we got the information from our Phoenix Police Department. They had 21 interactions with our Phoenix Police in just that 6-month period. What was happening was they were moving their items in this cart to different businesses. They were reporting it for trespassing. Police would go out, they would just move. We needed a solution to that, right? So they were declining our current shelter options. It was a couple, they had all these belongings. They weren't going to be able to go into any of our congregate shelters that we currently had. With the hotel option, that Sure Stay option, the street outreach preference, they moved into the hotel within 8 days of their street outreach enrollment. We packed up all that stuff and moved it right on in with them. And then they were housed in their apartment through rapid rehousing within 90 days. We touched base with the City of Phoenix Police, and they have had 0 interactions with police since they moved into their apartment. Oh, looks like we're missing, or I messed up something. We're missing a slide. But basically, it's on the evolution of using these resources that are coming into our community as a long-term asset. So we have the ARPA funds that are coming out. We have the interest of the federal government in giving us funding for housing. And so in the same way that we work to, sorry, I have to use this, the way that we work to make sure that we were filling more than just the COVID-19 gap with the resources that we had, we want to use these funds on acquisition and rehab so that we have more properties in our homeless sector so that when these types of things happen, we're able to quickly respond. The way that Community Bridges has applied for community development block grant funding, and we were awarded. So we're currently searching for a congregate shelter location in the Northwest Phoenix. We've also applied for some ARPA funds to purchase our own hotel in the city of Mesa. And the key thing with that, just like what Lisa mentioned, is it's all about community engagement. The entire program design is going to be built on what the neighborhood individual, what the business owners in the neighborhoods, what the police department is in need of. We will continue to ensure that it's at a 1 to 25 caseload ratio. So we've got the right level of support staff on site. We use reporting and access into the coordinated entry system so that we can help people who move in be able to be referred to the housing resources that come. So just if you have any providers in here, whenever someone moves into one of the hotels, they get pulled into a report that tells us, have they completed everything that they need to be referred through the coordinated entry system? Do they have their VI SPDAT completed? Are they showing document ready, yes or no? So rather than having to have case managers go in there and figure that out on an individualized basis, the report just comes out. It'll tell us that out of the 75 people we currently have staying there, 5 of them do not have what they need completed to be on our community by name list. Now our case managers know to go target those 5, get it done. And that's how we're getting so many vouchers targeted towards these hotels, is by using the time that they're there to get all that completed. The models that we're working on for these locations are emergency shelter, because, you know, just looking at what's happening with our police, it is something that we're lacking in our community. So, I mean, we may change the language, but people are currently residing on our streets in unsheltered situations. So regardless, we're going to need to make sure that we've invested some of our funding into emergency shelter options for people to be able to come indoors, where we add support services to. But that's just one piece of it. We do need those multiple interventions. The bridge housing model, we want to continue on with the bridge housing model, where we have enough resources. So if folks have been referred through coordinated entry, then they have a bridge location where they can go to, where they can reside while they're working on getting into their apartment. Community Bridges is also looking at the recovery housing program option. So when we purchase a hotel, we may put up the recovery housing option so that people who maybe have been in permanent supportive housing and are suffering from isolation, they would maybe do better in a structured environment with others nearby them. They might move into that recovery housing model because it would be something that we have available that we currently do not. And then, of course, lastly, is using them for permanent supportive housing. We are in our system with landlords selling properties and then no longer accepting our vouchers. We are constantly trying to have new units. So using these assets that are coming into our community to purchase and own them in the homeless service sector and then add new permanent supportive housing units is exactly what we want to do. And if we look at that evolution, right, where we had only families going in for 5 to 7 days to what we've been able to achieve now, just together, we'll be able to get there.
Thank you, Liz. That was fantastic. It is so impressive how both of these women and their organizations were able to quickly change their service model to adapt to the pandemic and then make it such a wonderful change that it's a model for future services. It was very successful. So very impressive. Thank you.
Thank you.
Yeah. Any questions for Liz? Or both? Do we have questions on the virtual track?
Yes, so we actually had one come in the transition. So this is for Lisa. What percent of CAS elderly program that were into the transitional facility were chronically homeless?
You know, I know that, but I don't think I have it with me. Boy, let me text somebody and see if I can find out. We're doing a final report. I mean, we did collect that data, so we're doing our final report, but take the questions to Liz and I'll see if I can get you that answer.
Anybody have any questions for Liz? Could you come up to the microphone, please? So the virtual viewers couldn't hear questions before unless it was on the
gotcha.
microphone.
I know it's going to be not a silly question, but one that is real and we all know is real. How did y'all, for both of you, with pests? You know, I mean, especially you're like in that picture, you got the cart piled full of stuff and you're moving it into that hotel room. I mean, what did that look like in terms of pest control and just trying to keep bed bug free environments and things of that nature. Can you talk on that for a little?
Yeah, I mean, it's a great question because I can imagine any property owner being like, my goodness, she just said they moved that into the into the location. But honestly, people aren't going to depart from it. So we've got to have systems in place that allow for us to be able to do that. It was 90 days, it changed their life now that all that's in their apartment, but we had bed bug tents at all of the different hotels. And so when people would arrive on scene, we would put it into the treatment center so that we could, at least clean it for what items they were bringing in initially, and then they would move it in. And then other than that, it was just a great relationship with the hotel owners. Constant case management where we're going in and we're doing room checks and we're assessing for hoarding issues and, and cleanliness of the location and monitoring for sites of pests so that we can get ahead of it as quickly as possible.
Can I jump on? We had a, hot box for items. And then we also had storage on site, a Conex box. So people would put their bikes and other items in there. Twice a week, laundry, their personal laundry was picked up by a nonprofit called Social Spin, which is really a interesting model that they have. And they provide, I believe, once or twice a week, some free laundry services at the laundromat for persons experiencing homelessness. Pretty sure. Don't want everybody to run there and think they provide it free, but I know they do some things that are really extra special for community members in need. And if there was someone hoarding, daily room checks, conversations, things would be addressed. I thought you were going to ask about pets or service animals, because we did allow service animals initially, and then the hotel asked us to stop doing that because one animal caused a little damage to the room, even though all the rooms are getting repaired.
Other questions?
Kevin for Intermountain Community Partners. So to piggyback off of his question, let's hypothetically say they're not capable to transition out of the hotel and they're not stable enough to live independently. Do the staff stick with the client in the hotel? You guys keep them in the hotel until they're actually ready to transition to independence? It's kind of blurry to me on how that looks.
It's definitely individualized, and the model for the hotel is independent permanent housing. So they do sign a program agreement when they move in that they'll meet with the case management staff at least once weekly to work on that housing plan. And that's vital, because what happens sometimes is they end up getting a little bit comfortable and then no longer meeting with us. Yeah. So what we do in that actually, and for that couple, for instance, and they gave me the authorization to share this with you all today. So, but for that couple, we had to lock them out of their room at one point because they were leaving every morning and they weren't coming back and they weren't engaging in their housing plan. So we locked them out of the room, and then they came to the front desk to try to get back in. And we said, hey, we got to meet with you on your housing plan. And then so through that, eventually, they continued to follow up until they moved in. Yeah, it's just, but definitely very individualized, very creative, very, very creative, very supportive. It comes from a position of love. And that's what's most important. When you lock someone out of your room, it's from a position of love. And so I think that sometimes we do have people come in who have significant mental health issues or concerns. And we see that once they move into the setting, and then we use our clinical staff to be able to address that. Sometimes it happens through petitioning, connection to adult protective services. It's assessed, and then we would work on transitioning them over to the appropriate setting. Yeah.
So we have about 30 people left in our hotel. Everyone has a housing plan. There may be a couple who need to go into a bridge housing. Our staff are talking to CBI to see if there are places for some of them so that they don't have to come back to the 470 bed shelter, but there is room for them. It's not the most ideal setting for some of these elderly folks, but everybody has a housing plan.
Well, let me start out by just saying thank you to both of you and your organizations. What you're doing is really critically important, and you're doing a great job at it. I'm interested in the long term. They say, there's a saying that says, no good tragedy should be wasted. And this is an opportunity to start thinking differently and to try to look at how can we make some of these things last long-term? So I'm interested in two things. One aspect is if you were renting rooms or buying blocks of rooms, is it your plan to acquire the hotels? And I got a sense from CBI that at least at one you are, but I'm interested in your kind of strategic plan. And second, how do you fund this when the CARES money runs out? Okay. It's hard to rely on just CDBG because there's so many people competing for those dollars. How do you fund this thing long-term? So would appreciate your thoughts. Thank you.
We're in the process of buying a hotel. We close escrow at the end of October. All things going well, we'll have a hotel of about 130 rooms. 5 years time from now, there's the possibility it could be converted to permanent, supportive housing or affordable housing. Not saying that's what we're going to do, but I think that's one option. Long term, we absolutely need more creative models and options so that someone has a different choice than coming to an emergency shelter. So there's a lot of good ideas, I think, being discussed at the city level for Phoenix, at a lot of city levels in our county, as well as with Maricopa County. And I think we need to keep those conversations alive, and then providers need to work together to advocate for those things.
And for us, it's the ARPA funds. As the COVID dollars come in, it's about property acquisition and rehab, because those are assets that over time gain equity. And so we want to use those funds in the most strategic way possible to acquire buildings that we can have for all time. After that, it goes to operations. And so we have a lot of conversations and advocacy going on around how do we continue to operate these locations once we own them? How do we treat bed bugs, 2 years from now is something that we have to try to figure out as a system. Community Bridges, though, yeah, we have a realtor that is actively looking for hotel properties right now. We're a provider, so once proposals come out, we then apply for available funds to do the acquisition and rehab of properties that we've found. One of the key things, too, I didn't mention is in every single hotel location that we went to, the emergency calls were decreased at those sites because they were typically like the lower expense properties. And so there was a lot of kind of like riffraff that was going on. So once a CBI navigator was on site and that was happening, they're like, not the place anymore. So it was leaving. So what we're doing when we're trying to look at hotels to acquire is look at ones that are in need of revitalization already.
Our Project Haven Hotel was pretty high-end neighborhood, and we did not have neighborhood complaints. And so that was a success when we take neighbors to tour and they see that, and they see a nice location and think, wow, that low-end hotel that you're acquiring that used to have a lot of crime, just as you're saying, could become something great in the neighborhood. And this is a model. So I think people, if they can see something and really feel it and understand it, it's a lot easier to get into a community. I think a lot of other options, there are all kinds of different options. The House of Refuge models, I think they're here in Tucson. I know they're in Phoenix, where you have smaller housing models. I think it's a faith-based. There's the rescue missions. You have the Center for Opportunity here, which is incredible. So I think there's all kinds of models. And I think the fact there's so much ARPA funding is, if you're thinking about doing something, find a model that works for your agency. I am curious if folks are in the process that are in the audience doing things that we could learn from too.
Another virtual question.
Yeah, we have 2 more virtual questions. The first one sort of builds off of this gentleman's. And Deirdre asks, what are the long-term prospects for continuing to adapt hotels to help the homeless post-COVID once the tourism industry has fully rebounded?
Long-term, say that again.
What are the long-term prospects for continuing to adapt hotels to help the homeless post-COVID once the tourism industry has fully rebounded?
Well, the hotel we're in now says that the nice hotel says we saved them this year. So the funding that we got through the CARES Act saved them. They're going to go back to being a regular hotel. Part of the reason they kept 20 rooms for the public is they didn't want to lose their mantle because they're affiliated. By the way, I can go back and answer the chronic question that you had. I got a text, 39% of the seniors who stayed at Project Haven were chronically homeless.
I think we purchase them now to the extent possible and then renovate them.
Yeah, I'm afraid the prices are going to go up if we don't get into quick action. We've been in escrow in this hotel for quite a while.
Ryan asks, who may I contact in your organization to help fill your need for properties to accept vouchers?
Well, I'll give my direct information and then get them to the right person. My, should I just give my email? I had it on the beginning slide or,
Yeah, get there.
okay. And it's Lisa Glow, Glow, and I'll give you my email and phone. Vouchers are critical.
And landlords who will accept the vouchers are critical.
Right.
Yes.
Well, we need to also work creatively with landlords and find ways to get them to accept our clients. Some of the landlord incentives, I assume that's been discussed in some of the sessions or will be, are helping. I don't know, if you've been able to tap into some of those landlord incentives, but we have working with Home Inc. So my email is lglow@casaz.org, 602-448-2270.
As a system, we're working to try to address this. So company Home Inc. has PAD mission, and I would recommend reaching out to them.
And then we got another question from Lori. Do all populations do okay in this motel model, SUD and SMI populations? I would think they might need more support.
Yeah, they've done fantastic in this model because previously they were living on the streets. So by bringing them indoors and giving them their basic needs met and then adding supportive services, we've been able to engage them and help them obtain sobriety, get connected to mental health services that honestly, sometimes they already had clinics already established, and we found that their clinic was looking for them, but their clinic was unable to locate them because they were living on the streets. So a ton of fantastic coordination has occurred by bringing them indoors and providing them with supportive services to help make those connections.
And being able to interact in a large shelter model, it's much harder for a person who has SMI or other challenges to feel safe. So we've had a lot of folks, they just feel safer and they're very connected to their case manager and to their community, and they can isolate. Some of the folks who are left at the end, they're harder to house, most certainly. Maybe there's a criminal record or an eviction. They don't want to go somewhere that's going to accept them. I've sat in on case management meetings where they don't want to go to a place that will take them. They're like, that's not a safe neighborhood. I don't want to go there. So there are definitely challenges with certain individuals. So we don't have that housing. So we need more of those models too, to take folks.
No other question? Any other questions from the audience? Yes.
How's the interaction been for you both with the different cities and the areas that you're in for the hotels and stuff? Has the city's been acceptable with it?
So the question is, how has the interaction been with the cities? I have to repeat it for the virtual watchers. How has your interaction been with the cities that you're in with the hotels?
The cities have taken a leadership role in this. I think it kind of started in those community conversations where we all started talking about how we were going to address this together. So they maintained that leadership role. When we were awarded our CDBG funds for shelter acquisition, the city reached out to us to tell us who those neighborhood business owners were, helped us with those connections. So they've been very receptive. And like I said, they've taken that leadership role.
And at Project Haven, we actually had 2 city staff, housing staff, using one of the rooms for an office. I forgot to mention that. It's been a partnership, and there's been a weekly communication on the numbers served, how many housed, vouchers, the whole bit. So it's been a partnership that's been different than before, made a huge difference.
Any other questions? Okay, well, I want to thank you both for a fantastic session. Thank you so much.
Thank you all.